Hey guys, it's been a while since we've talked. Hope everybody's enjoyed their summer. We've got a couple of questions more recently about fillers. When can they be used? Can they be dissolved? Is something a lot of people have been asking. So we figured we'd pick up on that and talk a little bit about the different types of fillers.
Yeah, so really important to distinguish between permanent and non-permanent fillers. The most common non-permanent fillers you see that are used are often Juvederm, Restylane type of fillers. Those are very easily dissolved with an enzyme called hyaluronidase. So if for some reason there's a problem with it, you don't like what it's doing for you, there's a little nodule, a little irregularity, it's very easy to go back to your doctor and have a little bit of this hyaluronidase injected. Filler goes away.
That's one of the great things, I think, why we like those sorts of fillers is exactly for that reason. You know, you can put in what you want, or if somebody goes and has too much put in somewhere else, you can oftentimes dissolve it and sort of break that down. That's very different than some of the permanent fillers that we don't like and we don't really use in the practice here.
Yeah, certain fillers like silicone-based fillers and others, those can be real problems.
Yeah, Artefill, things like that, they've been FDA approved for certain usages. Just in our opinion, anything that, is permanent like that, where, if you're young and you're 20, 25, 30 years old, the studies really aren't available where we could say, what is it going to do 20, 30, 40 years out? So we avoid those things, not necessarily because there's anything wrong with it. We just would rather not play those games with our patients.
And the reason for that is just it's difficult to get out if there is a problem. So
Absolutely.
The chances of problems are rare, maybe a couple of % or less. But when something does happen, you can have a long-term inflammatory, nodule inflammatory reaction that then usually requires surgery to try to get it out. One other note is for Voluma, which is a more recently approved, longer-acting filler in the Juvederm family, but it lasts for up to 2 years. It's a little bit harder to take out with the enzyme. Because it's so tightly cross-linked, it makes it thicker. That's why it sticks around longer, but it actually is a little more difficult to remove if necessary.
Yeah, so just be aware of what's available, what's possible. Have these discussions with whoever you're talking to about getting fillers done with.